I'm Dr. Naftali Serrano, a primary care psychologist. Today I'm going to briefly take you through the important things you need to know regarding antidepressant medication. If your doctor or primary care provider prescribes you an antidepressant medication, it's because he or she has noticed the signs and symptoms of depression and/or anxiety. Medication can be an important part of making things better for you, so let's cover some basic facts today. First, antidepressants are not addictive. You do not have to worry about becoming dependent on them. In fact, they actually take some time to work, usually 4 to 6 weeks of daily use to notice an effect. Some people notice a difference beginning in 2 to 4 weeks. This means that when you take an antidepressant, you will not notice an improvement right away. In that way, these medications are not like aspirin or ibuprofen. They work by slowly making their way through your system. But again, you won't have any difficulty stopping the medication. However, it will be important to tell your doctor if you decide you want to stop. It is usually best to stop them slowly. So, once you begin taking them, you will likely take them for a period of 6 to 9 months, every day in the morning. Let me repeat that, every day. Now I know taking medications every day is no one's idea of fun, but it is really important if you want to give this medication a chance. Remember, the medication works slowly, accumulating slowly and taking effect slowly. So taking the medication every once in a while just won't work. After 6 to 9 months of daily use, then you and your doctor can reevaluate whether you need to continue taking the medication. Some people do and some don't, but you can make that decision together with your doctor at that point. Yes, they really help. However, it is important to have the right expectations. For most people, antidepressants help with a good number of their symptoms. They may experience less irritability, more energy, and better sleep. There are some, however, who don't feel much of a difference at all. That's one of the reasons why there are a number of antidepressants out there. You and your doctor will start with one and adjust the dose on that antidepressant before trying another one. Now, there are some people with some types of depression that do not respond to antidepressants at all. You won't know until you try them. You should keep this in mind as you develop your game plan for depression. Now, because antidepressants don't cure all symptoms of depression, it is important that your game plan include other things besides medication. We won't cover these in detail in this video, but I can name a few things that really help. Exercise. In fact, some studies have shown that exercise is just as effective as medication. Increasing time spent with good friends. Increasing time spent in fun activities. And talking things out. Well, as with any medication, there can be side effects. For most people, the side effects are very mild and not difficult to deal with. I can't list all the side effects for all antidepressant medications, but a few of the common ones include dry mouth, constipation, drowsiness, wakefulness, blurred vision, dizziness, mild anxiety, weight gain, sexual problems, and nausea. Doesn't sound great, does it? Well, don't worry. Again, most people have mild side effects, if any, and they usually disappear after the first 2 weeks of taking the medication. And none of the side effects are permanent. Now, since the side effects tend to be mild, you don't have to worry about changing your normal routines. You can drive and do just about anything just like normal. It is a good idea, however, to stop drinking alcohol, as this can interrupt the work of the antidepressant. And remember, don't suffer in silence. If you have side effects, especially after taking the medication for 2 weeks, talk with your doctor and he can discuss strategies to deal with those side effects, including lowering the dose or adding a new medication to help. Finally, it may be helpful to know what the medication does to help. Well, the basic idea is that when we encounter stress, especially chronic stress, our body responds biochemically. What this means is that we can have less of the natural body chemicals, in this case called neurotransmitters, that help with energy and mood. So the medication actually helps increase the amount of these natural body chemicals so that the impact of the stress is lessened. You can think of it kind of like taking a brain lubricant to make things work better. Well, I don't want to overload you with information today. I hope this gives you the basics you need to successfully take the antidepressant your primary care provider has prescribed. Now, the only thing left is figuring out a way to remember to take the medication every day in the morning. Hopefully you and your doctor can figure out a system that works for you, especially if you're having to remember to take multiple medications at once. Work on it. It's worth it. If on your next visit you want some more information on side effects and what to do about them, ask your doctor to show you our video clip on side effects. For now, for iPsyc.com, I'm Dr. Naftali Serrano.